and welcome back to Mother Tongue, your eyes, ears, and finger on the pulse for all parents around the world. Let's get going, shall we? We are so incredibly excited to welcome Kate Negus to Mother Tongue. Kate, how are you?
I'm good, thank you. Thanks for having me on, Marianne.
Oh, thanks for being here. Happy Friday.
Yeah.
Anyway, as you know, we're talking all about C-section and C-section recoveries today, and I feel like nowadays, I don't know why, but so many more people seem to be having C-sections. I mean, I would say 70% of people I speak to are having C-sections nowadays. I actually think more people are having C-sections than natural births. I'm not really sure why that is the case, but it seems to be the case.
I totally agree with you. Yeah, I mean, I think since I had my daughter 4 years ago, I think that even in London, I'm in London, by the way, people are given so much more options and flexibility about how they want to birth, and the numbers are rising. I think at the moment, statistically, the numbers that they have are working on are saying sort of like 1 in 3, but I actually think it's more than that, really. I think that it's more sort of between 1 in 2 and 1 in 3 at the moment, the numbers.
Yeah. To be honest, I would say here it's more than that, a lot more than that. I feel like a lot of people are being talked into having C-sections. I feel like there's a lot more kind of emergency C-section situations within first births, and then, you know, people then often have a second C-section, maybe a third C-section with births after that. I have had 1 C-section myself, actually, with my first child. So I've been there. I feel like I've done that, got the T-shirts, and I'm excited to talk about it all today. But before we get into all things C-sections, can you start by telling our lovely listeners a little bit about yourself?
So I'm a mum of 2 children, and I, like many of you, I imagine the same as you, ended up having an emergency cesarean with my first child. I was induced and failed to progress. I know that's a touchy word, and it's like a sensitive word with failure. There's lots of people have that label around the C-section, and because the medics, that's what the medics always say. They don't care about throwing that word around. I failed to progress, and the baby ended up getting in distress. And although they were really holding off giving me the cesarean, I went like probably a good few hours longer than what I should have done. And that was 7 years ago, whereas now, like even when what we just had the conversation was, I just think that the hospitals just don't do that anymore, and there's so much more on it with giving the emergency and going through with the emergency cesarean. Anyway, so I had my emergency cesarean, and I just totally hadn't planned I never considered I would end up having a cesarean. Nobody in my family had ever had a cesarean before, and it was just a massive shock psychologically, let alone physically, what the recovery is like, which obviously you know and have experienced yourself. But just coming to terms with it psychologically, I was absolutely astounded at the way the discharge procedure, the lack of information, the lack of advice. And you just sort of get patted on the back and sent home with nothing really, other than don't lift up anything heavier than the baby, you know. And I followed that advice. I did nothing, didn't lift anything heavier than the baby, and I had a really, really hard time with my recovery, emotionally and physically. And I got in this I was almost scared to re-establish that connection that needs to be done quite early on now. With hindsight, I know this, and with helping so many women, but I really struggled with the acceptance of the scar and the fact that I'd had the surgery, and my scar didn't heal well. You know, I ended up experiencing lots of pain, lots of discomfort. It didn't heal well aesthetically. Then that started to impact me again. My self-esteem and like my confidence started to be affected. And, you know, I just felt like there was nobody that you could turn to ask about your infections, or is this right, or what could I be doing to try and help with my recovery. And because I was the only woman in my family who'd ever had a cesarean, and none of my close friends had, I didn't even feel like I had any sort of support community around me in that respect, because everybody was like, oh, well, I don't know what to do. And the only sort of interaction you had was with the community midwives, and you know, like this is an astonishing thing, but there is no scar recovery in the community midwives training. You know, like which is like mind blowing, really.
Yeah. Absolutely crazy. So, I mean, when you said, so can you just talk me through kind of like your first couple of months at home? Like, because again, recovery from a C-section, I remember the day so vividly when I just had the baby and they were like, I think it was like a day later, they were like, right, get up. I was like, are you joking? You've just cut through 7 layers to get a baby out of my stomach. Like, I can't get up.
6 hours, I think I was told to get up. 6 hours, and go and get in the shower, shuffle to get in the shower.
Shuffle.
And then they said,
and you can't stand up straight. You're like, I feel like a little hunchback. I was kind of like crouched over. I was like, I'm never going to be able to stand up straight again. This is awful. I was terrified. I was like, what is this? And the whole experience, I think with your first as well, like I remember them putting Rafa on me, and I mean I'm like pinned down to the bed, I can't move, my whole body is numb, and they're like, here's your baby, and I'm like, okay, what? There's no connection, there was no nothing, and then they ship you off to a bed, you've got bags to pee in and everything else coming out of you, and I was like, what's going on? And then they're like, yeah, now get up. I'm like, no.
What? I'm not going anywhere.
No.
I didn't even have that though, Marianne, because the baby was in distress, and then I ended up, my emergency was at like 5 a.m, because I think from about 1 o'clock at night they'd been like, no, we'll just see if you progress. And it got to the point when the baby's heart rate had really dropped at like 4:30 in the morning or something. I'm like, right, okay, we're going to need to do the emergency cesarean, push me through to have it done. So I didn't actually get my son put on me. Then they took him off to check he was all right, and so I didn't end up meeting my son till about 2 or 3 hours later.
Oh my gosh! So that's even more traumatic.
Yeah.
Bloody hell!
So,
I mean,
and then I think I went into recovery, and then just exactly like you said, I think about 6 or 7 hours later, I was told to get up out of bed and have a shower, and then they would remove my catheter. If I got out of bed, they would kind of like trade off between you doing
yay, the joys, just what you wanted.
But actually now, like with my knowledge and how much I know about the recovery, it is good to try, and as much as it seems like an impossible feat to get out of bed, it is a good thing to try and get out of bed and start moving around. Exactly.
Yeah, exactly. And then we'll come on to that in a second. But yeah, it is wild that you then get sent home, you know, especially as a first-time parent. It's like, here is your small human that you've never looked after before and you have no idea how to look after. And you've been sliced open. You're barely mobile. You can't lift anything. You have to lay in bed. And it's like, how do you even start to process that and recover it? I mean, what for you was the hardest part of your own recovery? What really triggered you to set up C-section correction?
I think that there was just a lack of, I felt like I was so out of control of everything that had happened with the birth. It didn't go to plan, and you know, like I didn't end up having the vaginal birth that I always envisaged I'd have. So there was a big loss of control there. And then to be discharged from hospital, another problem that went wrong was I was allergic to the clexane, which is the anti-blood clotting injection. So you're discharged with a pack of 10 injections, and you inject yourself daily for 10 days after birth. And I was actually allergic to the drug. And once you get discharged from the NHS maternity wards, you can go back to the maternity ward within 24 hours. But beyond that, then you have to go back through A&E. And my body every single day I was red from head to toe with this allergic reaction that I was having to this drug that I was being told to inject into me. So my scar was so sore and so swollen and red and inflamed because it was an open wound. And my whole body was trying to dispel this drug that was inside me. And I went back to the maternity ward, and then I think I went back because the next day I took the injection, my skin started to flare up, and then I think it was like 48 hours. I was like, this isn't right. I need to go back. But the maternity wards wouldn't see me. Then I had to go to A&E, and it was just one hell of a process. And they just kept saying, it's not the clexane. You're not allergic to the clexane. I mean, I think it's quite rare that happens. But I think that it was all spiralling, and it was really affecting me mentally, the because I'm quite like to be in control of things, and I just felt like I wasn't in control of anything. And then, needless to say, I didn't heal. Once we'd sorted that out and the medics had realised that and the doctors had realised that was a problem, I stopped taking that. And yeah, I did start to recover slowly, but it was a big setback because it took about a week for them to realise that I was allergic to it. And then my scar had obviously opened a bit because of the inflammation, and so it was just a really long, drawn out process. I didn't heal well. My scar wasn't a nice, neat scar, which I was disappointed about as well. And I'd developed an overhang, and I had like pain around my scar site. I constantly used to get like shooting pains in my scar site. So then when I fell pregnant, and had my daughter 2 years later, so I fell pregnant just over a year later, and my obstetrician sort of recommended that I had another cesarean. I just thought I need to take better control of this situation, because the whole thing from before the birth, when it was all a big rush, I thought I need to manage it better. And I just wanted, and by doing it, I felt so much more empowered. And it's nice. I took back some control. And I'm not going to let myself get in that situation. I'm going to do everything I can to be proactive and productive about the way my body's going to recover this time. So I set about investigating things. I spoke to a couple of cosmetic surgeons, spoke to my dermatologist, did research, and basically put together this plan for myself, which has now become my recovery kit for other women. Like, I didn't ever do it as a kind of with a business in mind. It was purely for my own benefit. And second time, my recovery was like polar apart. It was so much better. And bearing in mind I had a toddler to deal with as well, and like when they send you home and go, don't pick up anything heavier than the baby, which they did the second time as well. I've got a 2-year-old to look after as well. I'm not only going to be picking up my baby when they tell me not to, I've got a toddler to pick up too. So, like, even in that respect, which makes your recovery slower because you've got another small child to look after, my recovery was like a completely different story. I felt stronger, I felt more able. And just by introducing some simple tools into my daily routine, my whole recovery, my mindset, my body healed better aesthetically, physically. Like, I didn't have the pain, and I just was like, surely other women care about this.
Yeah,
they do.
Sure. Well, definitely, because I think the majority of the time, I could be wrong when I say this, but I think the majority of women go into their first birth wanting to have a natural birth. There are women who definitely choose to go and have a C-section for their first birth. But I do think the majority go in and they just want to see what happens. They don't really think that they're going to have a C-section, and then it happens a lot more often than you think. And everyone is then totally unprepared for what comes next, because they're like, well, this isn't part of my plan. I haven't planned for this. And then it's kind of thrown on them. You have that mental kind of head block of, oh my God, what has just happened? I didn't want this. You have to deal with that. And then you have no idea how to help yourself. So can you just give us a few things that you put in place for yourself that really helped you second time round get through that kind of recovery process?
Well, firstly, was the introduction of I started wearing like a care suit, which is what now is in part of my kit. So it's like a medical grade compression garment. And wearing something like that, I mean, like when you relate back to, say, if you twisted your ankle, or if you had knee surgery, or if you had any other surgery which actually is less invasive than a cesarean, you would be sent home with some sort of a support. You would be sent home with a knee brace, you'd be sent home with tubular bandages if you pulled ligaments in your ankle, And when, as lots of us have experienced things like that, when you put a device on like that, a medical device, all of a sudden your whole ability to put weight on that part of the body is supported. So you feel physically and psychologically more assured and confident to move more fluidly. And it's the same with wearing this medical grade compression garment that I started to wear. Not only does it help support your back's overcompensating for the fact that your core is obviously being severed in 7 ways and sutured back up.
Yeah.
You've just had major invasive surgery, and your stomach and your core is like injured and healing, and so the rest of your body around needs support. And I think that by wearing that garment, which I did, I was so much more able to get around and just start getting on with my mum duties. You can't lay in bed. I know that's the ideal situation, is that when you've had major surgery, you lay in bed, because that's when your body will repair when you're resting. But let's face it, you don't get to rest when you've got a newborn. You don't get to rest when you've got a toddler. So by introducing some aids that can help your body, can enhance the recovery, like when you wear these garments, not only are you physically going to feel stronger and more confident to go about and to move, it also helps with your internal recovery, because it helps stimulate the blood supply to all of those healing layers that your body's doing its best to try and recover with the little sleep that it's on.
Yeah.
So physically, it's helping the repair mechanism by supporting the area, not letting your body being overcompensated on the back or on the pelvis, on the hips. Your whole body is better supported from that. Your blood supply is going to be better. Also, it helps with the lymphatic drainage. So, the swelling and stuff, it gets you down. It makes you feel lethargic. It makes you, all of these side effects of and benefits of wearing the garment was incredible for me, and it just totally transformed that part of my recovery. That's not going to get rid of the pain that I'd had, but with regards to dealing with every single day and the coping sort of strategy, for me that was a game changer.
Yeah, I can imagine.
And then when I got to week 6 or 7, I started to introduce scar massage to my recovery as well. And that again was another brilliant piece of advice that I was given, and that as well just completely changed the way that my scar looked, the way that my scar felt, and prevented me from experiencing all of the pain that I'd been feeling before. When I had my second delivery, the obstetrician said that there was so much scar tissue around the incision, and it delays the process. And so many women are so blissfully unaware of this, that when you don't take good control of your recovery and you don't manage your scar recovery in the best possible way and do scar massage, it can affect later deliveries by having cesareans, because it takes the obstetricians so much longer when they've got to manipulate and manoeuvre through layers of scar tissue. And scar tissue really grows, and it kind of grows in a web-like fashion. And it could, if you decided, for example, you wanted to have a VBAC the next time and things didn't go the way that you wanted it to, and all of a sudden you find yourself in another emergency cesarean because the baby's distressed, and then the obstetrician slowed down by trying to deliver the baby because of scar tissue. Women are just so unaware of
the benefits of doing it. Yeah.
Exactly.
Yeah, I mean, I was terrible at massaging my scar, and I'll come on to that in a moment. But in the early days, I think another thing that, I don't know if you were the same, but something that really affected me was the constipation. I was wildly constipated from all the drugs that they pumped into me. And I mean, I had an induction, so I had all the induction drugs pumped in. I then had an epidural, then all the drugs from the recovery. I feel like I was just one big kind of drug boat. I've just been pumped full of all this kind of stuff. It totally blocked my insides. And I remember it was probably 5 days, 5 or 6 days, I finally had some bowel movement.
And the pain of that, though.
The pain! Oh my God. I think it was the first night that we hadn't literally been up every single 30 minutes with the baby. It was the first night that he'd slept for 4 hours straight, and I was up going from the loo to the bath, to the loo to the bath. I was in so much pain. In fact, my husband at one point, he was like, should I call an ambulance? I mean, I was in tears. I didn't know what to do.
Yeah.
It was horrendous, and no one at all ever prepared me for how bad that would be, ever. And I had no idea how to deal with it. And then obviously the piles that came after that, I was just like, this is the never-ending cycle of
Welcome
shit.
to womanhood.
Yeah. I was like, why? Why did anyone ever suggest me have children? This is dreadful.
Yeah.
And, you know, when you have an introduction to motherhood like that, like it just knocks you. It just knocks you for six.
A slap in the face, isn't it?
Yeah. My
This is
God.
it.
So I always say now, regardless of if you're going for a natural birth or a C-section, always pack some form of like fibrogel or Movacol in your bag.
I literally did a post today on my Instagram about things to do first week of your cesarean, and I've like pointed at some things that you should do, and I've said about mint tea, because mint tea really helps with lots of women find like pain in their shoulders like after the surgery where like they've trapped air, and it's like it really hurts. So taking mints, that can help with that, and chewing gum, that can help disperse the trapped air. And this was one of them. But Novikov was one of the things I point at was like, make sure you take this, because it's not only, pardon me, it's not only the drugs that they give you before the birth and the induction drugs, which lots of women do have when they end up with an emergency, pardon me. Afterwards, it's the codeine, and I can't take codeine, so I didn't get into as bad a situation as what you did, because that just constipates me so badly. So when they said to me, did I want it? And I was just like, I can't take it. So then basically I just suck up the pain and just keep making sure I was taking my paracetamol and ibuprofen every 4 hours, but you sort of do them over every 2 hours. And that's another good tip for a cesarean recovery, is set the alarm on your phone. Don't ever go over the 4 hours, because then that's when you find yourself in so much pain and it can be overwhelming. So manage the pain control, and setting alarms frequently is a really good tip to do.
I agree with that. And I mean, you know, another thing that I feel like is quite overwhelming, especially at the start if you've just had a C-section, is the emotional side of it. I mean, I remember thinking, I'm not equipped to look after a child because I've never done this before, and I can barely look after myself at the moment because I can barely move. And I feel a lot of women, you know, they feel very emotional post C-section, especially if it's been an emergency. How did you deal with the emotional side, and what tips could you give to people who are going through this at the moment?
I think that a lot of people, when there is sort of this, the best thing I would say to do is to try and be proactive about your recovery by taking back control of your recovery, because like what I mentioned before about the loss of control, that's empowering to actually think, right, well, that's happened now. I've got hopefully you're in the position where you've got your baby and your baby's healthy, you're at home, and it's about acceptance, isn't it? And taking back control, and okay, that didn't go as planned, but because that didn't go as planned, I'm going to make sure that I better manage my recovery. So I think that you'll find it really refreshing, and like it's a really good thing mentally to then think, right, I'm going to look after my body, because not only do you feel stronger mentally for doing that, physically your body will thank you down the line when you don't start running into the plethora of complications you can get from neglecting your recovery.
And I was going to come on to that next, is in terms of like when things are going bad, like what are the key signs of I need to go and get some extra help here, I need to go and see a doctor? What are those red flags that we need to be looking out for?
So I think that I had a customer I've been speaking to for the last couple of weeks, and she's been, pardon me, bleeding really heavily. I mean, obviously, some women don't realise this actually, but after you've had a cesarean, you still will bleed vaginally and still heavily. Some people think that actually you don't end up bleeding because you've had a cesarean and the surgeons kind of suck the blood out or remove the blood during the surgery, but that's not the case. You still have a heavy bleed. But this particular customer had, client, and she was really heavily bleeding, was in terrible pain, and I think actually she's ended up having another procedure because there was some part of the placenta or something that was still.
Oh God!
There. So you have to trust your gut. So with things like that, if it's really heavy clotted blood, like I'd definitely speak to your community midwife, or go back to your doctor or your GP and speak to them about that. Any redness around the scar, like itching and irritation, like what I had. If you feel like you might be allergic to the Clexane or something else that you've been prescribed to take postnatally, just keep checks on things. Yourself, like if things doesn't seem right, if you keep getting repeat infections and your wound's not closing up, definitely seek medical advice, go and see your GP. It might mean that you need a short course of antibiotics, but some women are quite reluctant to want to take antibiotics. So something that I also recommend, and this is what I did on my Instagram advice thing today with the Movakov and the chewing gum and the mint tea. Another thing that I recommend that women take is a high dose of vitamin C supplement, because vitamin C supplements are amazing at helping fight flesh and wound infections. So if you're already taking that, it kind of is, from a preventative perspective, you're going to prevent, like, your body's going to be better able to fight infections and things, which all will influence how quickly your scar closes. And the less infections you get, the better, the neater and the cleaner the body of the scar will be. Because unfortunately, when you keep getting repeat infections, it does affect the line of the scar and the body of the scar. It will just keep widening it. And obviously, as much as we all want to embrace our cesarean scars, we also probably, many of us, want to embrace doing what we can to help it heal in the best possible way, aesthetically and physically. So, like just being mindful and doing something as simple as taking vitamin C, it really, really is a brilliant little tip. I get people who have bought the kit from me and they're like desperate to start using it, and they're like, I've got an infection, I can't start, because you can't start to use the kit if your scar's open and the scar's infected. And I always say to them, take vitamin C, and the amount of women that come back and they're like, oh my God, I've been taking it for 3 days and my infection's cleared. So
amazing.
Again, the medics don't tell you things like this because it's non-conventional, isn't it?
Yeah.
But yeah, it's a brilliant tip. I really recommend that. Yeah.
Love this. And then scarring. Obviously, scars we're kind of stuck with for life.
Yeah.
How can we minimize the scar? Because I remember lots of people shared lots of different bits of advice with me when I had my scar, and I remember the Mebo gel linings were something that people said were really good. You can massage oils into them. There's all sorts you can do. What is your advice when it comes to helping the scar recover and minimizing the appearance of the scar?
So you need to wait until you're 6 weeks postpartum and the scar is no longer oozing or scabbed. It needs to be completely healed and closed, and not before the week 6 point. And then you can start to introduce like light massage to the scar. And the reason that you're going to be doing this is to try and break down and manipulate the scar tissue formation. Obviously, there's 7 layers that have been sutured during the operation, and so essentially you've got 7 layers of scar tissue that can then form and then can be problematic in terms of growing and sticking to a number of organs and other tissue that is in that lower abdominal area. So in order to stop that happening and to stop the growth, which suddenly can grow quite rapidly, the scar tissue, it just all depends on you personally, as to how much scar tissue your body will create and the overdrive it goes into when it's trying to heal. But by regular manipulation of that scar tissue from the 6 week point, that's the earliest, you can manage it and you can totally change the outcome of the way that your scar heals internally. You can, you don't, people say, oh, I'm not a massage, I'm not put off or scared by doing it. There doesn't need to be some special technique, or you don't need to be a professional to do it. You can do it as a mum at home. It's about the regularity of it and just making sure that every single day you get in a routine of doing it. And when you follow my course, my recovery course, I always recommend that the women do it in bed or when they're watching TV late at night. and the baby's hopefully asleep, or like 5 minutes is all it takes. So you don't need to make a big deal about it. Do it when you're literally reading, like laying in bed just about to doze off to sleep, or on your phone, one hand, just like circular motions, zigzag motions, pulling the scar. Like as the weeks go on, you can get to the point where you can sort of pull the skin and drag the skin a bit, but it's just about the frequency and mixing it up and just making sure that you're just keeping that tissue moving. And some women do struggle with touching the scar, and you get women, like I was saying to you previously, that some women say to me, oh, I'm a year postpartum, I've never touched the scar. So that isn't going to be something that everybody's going to be able to do, the touching of the scar. So therefore, if that is the case, it's vital that you do re-establish the connection between the mind and the body again for the holistic recovery, you know. And in order to do that, a really good tip to do is, if you are scared or it makes you feel anxious or frightened to touch the scar, a really good tip is to do it over your pajamas, over your leggings. Just place your hands over the top of clothing and just breathe into it, and into your hands and into the scar and into your stomach. And by doing that, you're touching the area and your brain's getting used to touch, but through a fabric, it doesn't make it so invasive or such a barrier to do psychologically.
And what about, what can we massage with? I mean, in your kit, is there stuff that you suggest or that you put in with the kit?
We lots of people come to us and they say, oh, my surgeon said that I should use bio oil. You know, like bio oil is highly synthetic, you know, like it's full of parabens. It's actually made by the petroleum industry, so we don't recommend you use that. So in our kit we've selected the purest oil we could get. It's a completely natural oil, cold compressed virgin coconut oil, and there's no perfume in it. There's no colorants in it. It's a really simple natural oil, and when we was researching what we would put on it, because it's a new skin, the scar is new skin, you know, we wanted something to have no irritant to it at all. And coconut oil is naturally high in vitamin E. You know, it's going to help nourish the skin, and this new cells that are all trying to form on the scar is antibacterial, naturally antibacterial. It's anti-inflammatory, and it's antifungal. So all of these properties that it has is going to help with the scar, prevent infections, prevent problems, but it's just a clean natural oil, and we recommend that you use that because it's going to help with the softening of the scar tissue, it's going to help with the skin quality and the regeneration of the surface and topical skin, but it's also going to be able to give you the manipulation to work on the layers beneath it. And in addition to that as well, as helping the scar heal in the best way, is starting to use medical grade silicone strips, which again is part of our recovery plan, that you start at 6 weeks with the silicone strips. Silicone is it's like a gold standard in sort of cosmetic procedures with scarring. And it's a semi-permeable material that allows oxygen to permeate it, but yet it retains moisture. So this creates the optimal environment for the scar to heal beneath it, because it locks in the moisture but still allows oxygen to penetrate it.
Amazing. And what about the overhang? Is there anything we can do to get rid of this overhang? Because I've heard some people say the overhang comes from you being sewn up badly. Yeah. And other people say the overhang comes from you not recovering properly. So what do you think avoids the overhang?
It's probably a mixture of both, to be perfectly honest with you. But traditionally, everybody always just thought like the overhang is something you have to deal with when you have a cesarean. Everybody gets one. There's nothing you can do. And it's absolute nonsense. You can absolutely change your overhang. And so the overhang occurs because it is of the layers of the scar tissue all pulling the scar inwards and anchoring it in. As the scar spreads, and the scar tissue spreads, if you think internally, like I said, it's like a spider web, it kind of anchors to whatever tissue's nearby. And it pulls the scar inward, and that's what kind of creates the sort of overhang. The body's natural healing mechanism when it's undergone trauma is to cushion the area that's been injured and it does that by creating fluid around the scar. And unfortunately, this build-up of fluid, if you don't do anything about it and wear like a care suit like we have in our kit, and you don't do your massage and lymphatic drainage from wearing the suit and help disperse the swelling, it does unfortunately become a stubborn pocket of tissue, which does become resistant to diet and exercise, which I think was always why women was told that it's, you know, like part and parcel of a cesarean and there's nothing you can do. But absolutely you can change that. You can correct it even when you're several years postpartum, or you can prevent it from happening in the first place by following the steps and the routine of my recovery kit and using the tools in that.
So I know your product today is going to be a recovery kit, and I don't blame you, but I'm dying to know what is in the recovery kit. Can you just give me a list of all the things that you've got in this recovery kit and how people can get hold of it?
Okay, so in my recovery kit is, you know, like the first thing that you can, it comes with a mulberry silk eye mask. People think that's just like a gimmick in it. It absolutely isn't. Your body heals to the and it repairs whilst you sleep. And obviously it's an oxymoron that new mums don't get any good quality sleep and you get little windows of sleep. So we wanted to make sure that the little bits of sleep that you do manage to get are of the best quality. And it's been clinically proven that when you sleep with a mulberry silk eye mask, your body can achieve a deeper state of slumber. The REM is reduced, which is a rapid eye movement, so your body will be able to have a better quality sleep. And the better quality sleep you have, the better it will be able to undergo the repair mechanisms that it naturally will want to do straight after the operation, which does involve creating pockets of fluid around the scar, but that can be dealt with later on. Then it comes with a care suit. So the care suit is breastfeeding friendly. It has little clips here. It's also it's been proven that it reduces the pain of breastfeeding, as some of the pulling and the sort of contraction feelings that people feel from the uterus to the breast when they feed. It can reduce the pain and discomfort of that as well. So yeah, and it will support your lower back, the care suit. It will help with lymphatic drainage. It will help reduce the swelling around the scar. And it will just help you be able to get on with everyday life. This care suit goes right down into the lower legs, so it can still support all of the girdle, the pelvic floor, the lower back. All these things are overcompensating for the healing core. So every aspect of your body will be supported, and you'll just be able to go about your day-to-day mum life with a bit more confidence and reassurance with your movement. It also comes with a 4-month supply of silicone strips. This is the optimal length of time that you should use this product for, to help reduce the scarring and fade the scar away to as best as your body is able to heal. That varies from person to person, but by using the strips, your body absolutely will heal in the optimal way it's capable of healing in. And then you get a 4-month supply of the healing oil as well to do your massage for that duration. So yeah, it's it's a complete recovery roadmap basically for all of the women who feel sort of like this loss of control and that they have no kind of direction when they get discharged from hospital, and for many people who don't go privately and don't ever get to see, but the majority of people don't then get to see the obstetrician again who's delivered the baby. And it's about empowering them and giving them an opportunity to help themselves heal in the best way.
And then your biggest tip, if you were to give C-section mums one piece of advice, what would it be?
It would be to try and reconnect with your scar as soon as possible, and don't be one of those women that we speak to that are a year, 18 months postpartum and there's this mental block of being able to touch their scar and establish that connection again. You know, it's about, there is an acceptance and there's a certain process that you need to go through after you've given birth, if indeed it wasn't a planned cesarean. But the sooner you establish that reconnection and the sooner you start to, you know, re-engage with the scar mentally and with touch, then you'll not only will prevent numbness and you'll start to stimulate the nerve endings, which are all beneficial for your recovery. You'll prevent the mental and the psychological barriers that so many people get when they neglect to touch their scar, and start the holistic recovery between the mind and the body, which you know, like it's so important that it's re-established and built again.
So
And whether it be touching it through your clothing, you know, like anything, you just need to start to,
making that
even if
connection.
you're just laying there and you just place your hands on your tummy and your lower abdomen or near the scar, and then as the days or weeks pass, you move closer onto the scar. That's a good tip as well to do. But just do it, you know, like it's so important for your recovery.
And Kate, for anyone who wants to find this kit or find you, where can they reach out?
So my company's called C-Section Correction, and my website is www.csectioncorrection.com. We've got like a help and advice community sort of page on Instagram, which is C-Section Correction. You know, and we try and give women tips and advice, like for example, take vitamin C, massage tips, little things you can do. You know, and we often post questions, and if people have got questions, we'll put them on our stories, and it's good to listen to other people's advice, and we give our advice, and you know, we share all. And we also, like, if anybody's got any pictures of their birth or any videos, we like to put them up, because, you know, like, it's quite a uniting feeling that you know that you're not the only one going through it, and this is how, you know, like other people have been through emotional things that you have after your birth and going through this same recovery process.
For sure. I mean, thank you so much, Kate. Honestly, it's been such an insightful chat. I really, really appreciate your time. And I'm sure so many others will. And we'll, as always, link everything in the show notes so people can reach out and find you and ask any questions that they have.
Look forward to it.
Brilliant. You've been a star, Kate. Thank you so much for your time. Enjoy your G&T and have a great week.